Once I'm ready to clean the eyebrows and do the brow reveal, does microblading hurt? I get this question all the time. And more recently, I've been getting asked what anesthetics I use for my clients. In this video, I'm gonna share which anesthetics I use in order to minimize pain. If you're new to my channel and don't know who I am, my name is Christy and I'm the owner of Boss Brows. I've been in the beauty industry for 9 years now, specializing in microblading and microblading training. This channel is all about sharing my tips and tricks and business experience so that you can step up your brow game and become a brow boss. If you're a microblading artist, you already know this is a question you receive all the time from your clients. Does microblading hurt? How does it feel? The answer is, it depends. Everyone has different tolerances when it comes to pain, and pain is subjective. So it's really hard to answer that question universally. All I can do is share how I know my clients and try to minimize their pain. Obviously, when you're cutting into the skin, you are going to feel it. It isn't going to be a pleasurable experience, but the pain can also be minimized if you use your anesthetics properly. I'm gonna share the two different anesthetics I use, and I'm gonna share the difference between a primary anesthetic and a secondary anesthetic. The first thing I do when my clients come in is I start the consultation and I do their brow mapping. The reason I don't numb my clients first and then brow map is I don't wanna have to feel like I'm rushing through that brow mapping process. Topical anesthetics, or the one I'm using, only last about 45 minutes. And brow mapping can take anywhere from 15 to 45 minutes, depending on the client. So make your life a little easier and brow map first. If you wanna learn how to take off your numbing cream without messing up the brow mapping, I have a video on that, so I'll make sure to link that here. So primary versus secondary anesthetics. The primary anesthetic is an anesthetic that you're going to apply to the skin before the skin is injured. That means before you actually start your microblading. It's going to take a long time for this topical anesthetic to absorb into the skin. So my recommendation is using a primary anesthetic like Zensa. Zensa is a 5% lidocaine and it's a cream. So you apply the cream to the brows. You want to apply a decent amount of this Zensa numbing cream to the brows and leave it on for anywhere between 25 and 30 minutes. Another trick I do is I put saran wrap over the brows. This way it helps that cream absorb into the skin. While your client is numbing, you can do other things to make use of your time. I usually book their follow-up appointment, I review aftercare, I figure out which pigments to use, and then I set up for the procedure. All of that usually takes about 10 to 15 minutes, and then you can do other things like go to the bathroom, check your emails, you know, whatever. But make use of that numbing time. With primary numbing creams, the cream has to be removed. It doesn't all absorb in there. You don't want any of that anesthetic left on the skin before you microblade. I remove the numbing cream off of the right eyebrow first, but I leave the numbing cream on the left eyebrow. So this way I have as much time to do my first pass while the skin is still numb. Then once I'm done with my first pass, I'm gonna mask it with the pigment, and then I'm gonna go to the left side. I'm gonna remove that anesthetic from the left side, and then I'm gonna do the strokes on the left side. Again, repeating the process of finishing the strokes, put the pigment mask on, and now you're ready to do your second pass. This is when the secondary anesthetic comes in. A secondary anesthetic is the anesthetic you put on the skin once it's been injured. So this is on your second pass because you've already microbladed the skin, it's open, and now that secondary numbing is going to absorb super quick. The one I would recommend to use is Tag 45. I really like it. It's a gel. It has 4% lidocaine and epinephrine. The epinephrine is actually a vasoconstrictor, so it's gonna help minimize that bleeding. So I remove my pigment mask. I apply a generous amount of the secondary anesthetic to the eyebrow. It only needs to sit on the skin for about 1 to 2 minutes. With this particular secondary anesthetic, it is a gel, so I will need to remove it before continuing on with my microblade. The difference between the primary and secondary, the primary is more of like a cream, and the secondary is either a liquid or a gel. Primary is going to be 5% lidocaine, where the secondary is going to be 2 to 4% lidocaine. So now that I'm working on the right eyebrow and I applied that secondary numbing cream and left it on for 1 to 2 minutes, I'm ready to wipe it off. A little pro tip, you will know that this anesthetic is actually active because the skin will have a white halo around those little cuts. This is showing you that that vasoconstrictor is active and that your numbing is working on the client. Usually the secondary numbing is active for about 25 minutes. If you're a beginner and find that it's taking you a little longer, you can reapply the numbing cream. However, make sure that you're not overusing the anesthetics. Also, make sure that you're not leaving that secondary anesthetic on for too long. Because of the vasoconstrictor, the skin will feel a little more tough. So if you leave it on too long, it might really change the consistency of the skin and feel a little more difficult to microblade on. So once all of your microblading is done and you've cleaned the brows, apply the secondary anesthetic one more time. This again is just going to suck up all of that blood and lymph so you don't have to worry about blotting for an hour after the service. I usually leave it on for about 3 to 5 minutes after my service just to kind of seal those microblading strokes. I remove that secondary anesthetic and then I show them their brows. Now, does this mean the client isn't going to feel the microblading? Not necessarily, but the pain is going to be minimized tremendously. I have found that some people have different pain tolerances. That's normal. It doesn't mean that your anesthetic isn't working. It just means that people have different tolerances to pain. So where one person might tell me they barely feel anything at all, the other client might tell me that it hurts. Hopefully this helped and cleared up any of those anesthetic questions. Thanks for watching, and make sure to hit that subscribe button because I come out with new videos every Tuesday.